Hello again, everyone. This is Dr. Reheisse from Revive Sport and Spine, your Cottonwood Heights, Utah chiropractic and running injury specialist. Today we are kicking off our runner's knee special. It's going to be a 4-part series for us as we head into the fall. Utah is known for its downhill marathons, and we've got quite a few of them coming up, which is great if you're looking for a BQ, but it also sends us a spike of new patients that are experiencing runner's knee. So we want to talk basic anatomy and why downhill running can exacerbate or speed up this process of you feeling pain in the front of your knee. So as we talk about runner's knee and the anatomy, what we're looking for is really to just identify a couple key aspects of what we're looking at. What are the pain generators? So when we look at the knee, even though it's through my pants here, you can visualize we've got the femur bone, the patella or the kneecap, and then the tibia. And what we're really looking at here is how actually this patella interacts with the femur. Down here between the condyles, you have what's called a groove, a trochlear groove, where when we flex and extend our knee, that patella glides right through there. And a lot of times with patellofemoral pain or runner's knee, what you'll find is you get abnormal pulling side to side or a lot of tightness through the quads, and you get an abnormal tracking and a rubbing together of that area. The other key thing with runner's knee and the anatomy is runner's knee is typically a diagnosis of excluding everything else. We look at the ligaments, the LCL, the MCL, deep inside the knee of the ACL, make sure there's no injuries there. Usually without any trauma, those aren't going to be a problem. We also look at the patella tendon at the bottom, make sure that's okay, that we're not getting any tendonitis down there. Through the quadriceps tendon as well, you have all these muscles that attach to the kneecap through that quadriceps tendon. And then one of the other most common ones that we see as far as knee pain with runners is IT band syndrome, where that pain is typically out here on the outside of the knee or a little bit underneath that kneecap. Once we've ruled all of those out, making sure that we're not having any huge issues there, that's when we come upon a diagnosis of patellofemoral pain syndrome or runner's knee as we know it. So again, with the anatomy, we want to know the femur, the patella or the kneecap, and that trochlear groove right there where that kneecap should glide through every time we flex and extend our knee, which is every step we take when we are running. So why does this bother runners? Well, running typically puts an overuse strain on this area. So if you do have abnormal pull from side to side, you're getting a little bit of a tracking issue. Think about the thousands of steps you take every time you go out and run. So if you're having some maltracking, as we call it, and that's rubbing up against the side, you're eventually going to cause some pain there. The reason we see a spike in this during the fall is we have a lot of downhill marathons. A lot of people will train exclusively on downhill to try to prepare themselves and give themselves the best bet of getting their Boston qualifier before that timeline ends for the coming year. But one thing is just the mechanics and how the body works. Generally, your quadriceps aren't what's propelling you forward when you're running, but when you go downhill, they go into what's called an eccentric contraction or a negative contraction. So as you're going down the hill, instead of the quads propelling you forward, they're actually trying to stop you and slow you down a little bit as you go into that next phase of the gait cycle. And what we find is with eccentric contractions, it's a lot harder of a strain on a muscle. So if you're doing this, I think in Big Cottonwood Canyon, almost 20 miles of that is downhill, and a steep downhill at that. The quadriceps, if not trained properly, just get burned out. So that's one of the main reasons why we see a huge spike in runner's knee this time of year, because we've got the races, and a lot of people will exclusively train on downhill just to prepare themselves for that without taking a break and giving those quadriceps a chance to rest. So throughout this series, we're going to talk about multiple aspects of runner's knee. We just did anatomy and why it relates to runners. We're going to also talk about some of the other joints and how it impacts the knee, some of the things you can do on your own to help treat it, and then also when and if you should seek care, if you should continue running, and some of the things that we would actually do here in the office to help you get over runner's knee while continuing to train. So stay tuned. We'll have a blog post coming out each week discussing different aspects of runner's knee, and hopefully we can keep you from being a patient here in the office. But if you do need care and your train is already getting disrupted from knee pain, it might be time to come in. That we can help you continue to train and help salvage that race. So let us know what you think. Please share this with anybody that has an upcoming downhill marathon this fall, and we look forward to seeing you out at the finish line.